our final Think Global talk for the semester. We're so happy that you can make it today with everything going on in the world. Today's discussion is health disparities in the environment, who pays the price? And my name is Mary Brophy-Marcus, and I'm with the Duke Global Health Institute Communications team, and I'll be hosting our discussion. We have experts from Duke's Nicholas School of the Environment, the Sanford School of Public Policy, and our own Duke Global Health Institute. And I just want to note that we are an interdisciplinary institute at Duke. So that means that our faculty and researchers work across multiple institutes and centers at Duke. So everybody that you're hearing today is working in different arms of Duke. Looks like we have a pretty full room, so let's get started. Again, for those of you who just jumped on, I'm Mary Brophy-Marcus. I'm with DGHI, the communications team, and I'm going to be moderating today's panel. The topic is health disparities and the environment, who pays the price? Just for a little bit of background, humans are changing the environment in many ways, and these changes have negative effects on our health. But the impacts are often largest among low-income communities that already experience racial discrimination. Our panel is going to explore current research in communities that experience disproportionate effects from environmental problems, such as water contamination, air pollution, deforestation, and the built environment. Our experts are going to discuss how unsustainably exploiting nature's resources, some humans may be thriving right now while others are suffering. And meanwhile, the degradation of nature's life support systems are eroding the health of generations that will come after us. Our first panelist, each panelist today is going to spend some time just talking about their specialty area and their research, and we'll do introductions for each person as we go down the list. Our first panelist is Melissa Scott, and she's a postdoctoral associate at the Samuel Dubois Cook Center on Social Equity at Duke. Melissa's research interests are in environmental health disparities research, including climate change, air pollution, and the built environment, and looking at differential and disproportionate differences across races. Melissa studies cardiovascular disease risk factors such as depression, obesity, and hypertension in African Americans, and how these outcomes are affected by religiosity and spirituality. Her advisor is Dr. Keisha Bentley Edwards, who is a DGHI professor. And Melissa, I will let you take it from here.
Thank you so much, Mary. I really appreciate it. And a special thanks to the community of people who have come out to listen to this important panel today in light of the election week. I'm sure other things are on people's minds right now, so we're really grateful for your participation, and a very special thank you to Mary, Aaron, and Michael for organizing this and all the background that goes into organizing us all. So thank you all so much. So the first of 3 points that I wanted to discuss today is actually something I've been thinking an awful lot about in my own research. And this is the fact that systemic racism is very deeply connected to environmental racism. And I'd like to point out some really important work done by a professor at Southern Texas University, Dr. Robert Bullard, who's actually considered to be the father of environmental justice. And he writes a lot about environmental racism, such as his book on the wrong complexion for protection. And he describes environmental racism as an environmental injustice that occurs within a racialized context, both in practice and in policy, right? So some examples to think about as we explore this idea of environmental racism and how it's connected to systemic racism in the United States. There's a long history in the United States of redlining, of racial segregation in neighborhoods, of gentrification and displacement of people, as well as unequal urban design and the lack of capital and financing in some neighborhoods. And this really is important when we think about place, right? And where people live is really a powerful predictor of health. Which leads me to my second point, that the health impacts of climate change, air pollution, and neighborhood design are really racial justice issues. And here I'd like to point out a really important study that came out in 2019 by Tessem et al. That in part explains something that we knew, which is that Black Americans experience some of the worst impacts due to air pollution, specifically particulate matter at 2.5 microns, that's finer than the human hair, and lodges into the lungs of human beings, causing things like respiratory disease, lung cancer, cardiovascular disease, greater trips to the ER and such. But this study was really special in my mind because not only did it show that Black Americans are experiencing some of the worst impacts due to air pollution, but that white Americans are actually causing a lot of the air pollution, raising big red flags in the idea of racial justice in this country. And another element that's really current when we're thinking about air pollution is the connection between COVID-19 and the disproportionate impacts of Black Americans in urban areas that experience greater air pollution in the United States. Here I'm pointing to a study by Wu et al. 2020. And this is really important because as there's greater amounts of air pollution, there's greater respiratory disease and asthma, producing greater vulnerability right now for COVID-19 morbidity and mortality. And this matters in the context of climate change and health impacts, which are vast, one of which is the increase in heat mortality as temperatures are rising, but also when we have greater temperatures, it traps in air pollution more, exacerbating some of these health impacts. Which leads me to a third point that's really important to me and very much a part of the beating pulse, if you will, of the health equity group at the Cook Center on Social Equity. And it's actually a reiteration of a really important point made by an eminent scholar on health, race, and equity, Dr. Keisha Bentley Edwards. She points out that there's this really important need for students, scholars, researchers, and faculty to move beyond this acknowledgement that health disparities do in fact exist towards understanding the root causes of health outcomes, both positive and negative. And this really connects to my first point about environmental racism and the root causes, in that we have a pervasive history of environmental protection that is in fact supposed to protect all people, but does not protect all people. And with that, I'll turn it over. There's certainly a lot more I'd like to discuss here as we can unpack that throughout our panel. Thank you so much.
Sorry, I had my microphone on mute. Thanks, Melissa. We will definitely circle back to you. I think that last point that you bring up about the environmental protection is really interesting. And, how does that intersect with health issues? We are going to move on to Avner Bengosh, who is a professor of Earth and Ocean Sciences at the Nicholas Institute of the Environment, and he's a faculty member with Duke Global Health Institute. His research aims to link environmental geochemistry and isotope hydrology in order to trace the sources and mechanisms of water contamination and relationships with human health. Avner, you can take it from here.
Hi, hello everyone. Thank you for attending this session. I'm going to talk to you about some chronic exposure of naturally occurring contaminants in drinking water, what we call it the silence pandemic, that we are not much aware of it. And basically starting with that I'm sure everybody is aware how the world is becoming more thirsty and we are facing a global water scarcity. Usually we are looking at different issues right now, but the kind of systematic water scarcity is growing, and it's almost everywhere across the world. And today I want to kind of highlight some additional topics that usually we're not on our normal radar screen. And basically, you're all aware that we are facing multiple global water resource challenges. We are talking about issues related to water and agriculture and food security. Do we have enough water to sustain our life? We are talking about a huge population in some countries still don't have access to clean water and sanitation that affect their livelihood and their health. We are talking about groundwater resources that are the major source for agriculture are being depleted and contaminated around the world. And on top of that, we see climate change effect of continuously drought and flooding events on top of pollution. And also very important topic that usually we don't much aware is how much water we use to generate energy. And this is becoming really a major thing. Every time we turn on the light, we're using a computer, we're using a huge amount of water, specifically in North Carolina, because we're depending on coal. And the water energy nexus is something that really affects our water availability and quality. And basically, we are kind of stuck in a really vicious loop of we have more development, more water depletion, resulting in water stress and water quality degradation that is derived from both overexploration and human activities, as well as it is exacerbated by global warming processes around the world. And those two working in parallel level. When we talk about global water pollution, it's a very well kind of known that wastewater, raw or treated wastewater sewage is a major issue that causing pathogens and nitrogen contamination of water, agriculture affecting water resources, the industry and the energy, they have different and differential effect on water quantity and water quality. But I like today to bring you the focus on naturally occurring geogenic contaminants in groundwater resource, because we don't see those contaminants and most people are not aware of them. But basically, when we are having groundwater, they are having interaction with the host aquifer rocks from which they flow in. And many constituents that exist naturally in the rocks would be mobilized into the groundwater. It could be arsenic, uranium, radium, salt, fluoride, and hexavalent chromium. And eventually they will end up in our tap water. And many of those naturally occurring contaminants, they would have a really severe impact on human health upon long-term and chronic exposure to those contaminants. And those contaminants, you cannot smell it, you do not feel it, and the impact is not immediate effect. So you don't know you're being poisoned by those contaminants. So that's why they're so, we call it the silence pandemic, because they are existing in water resources and we're not really aware on their impact. For example, arsenic is existing all over the world, which having a really severe health effects, particularly in the Southeastern Asia, along the major rivers and the delta areas where arsenic is highly prevalent with very high concentration, like in Bangladesh, that affect millions of people living there. Fluoride is another global phenomenon that affecting many people, specifically in Eastern Africa, in India, in other parts of the world, causing fluorosis. And also there are new studies that also affecting cognitive ability of children. And in India, we recently discovered that uranium contamination is highly prevalent in many of the groundwater resources, drinking water resources. In India, they're suffering from multiple geogenic contaminants, including uranium, fluoride, and arsenic, and sometimes they coexist and affecting the human health. The Middle East is suffering from a major radium contamination in fossil groundwater that affecting Egypt, Saudi Arabia, and Jordan, and some part of Israel. And this is a major problem because this is one of the last water resource available that they can have. And having radium in your drinking water or uranium would have a huge effect on either chemical effect for uranium or radiation effect in the case of exposure to radium or radon in water. And finally, as an example, going back home, here in North Carolina, many people along the Piedmont region of North Carolina are exposed to hexavalent chromium, which, as you know, is an extremely high toxic element in the drinking water. We found that it's naturally occurring and with a high prevalence in the water, specifically in some hotspots, which are all related to the geology of the aquifer from which people are extracting the water. So it is interesting when we are focusing on North Carolina, which is similar to many parts of the world, is that the rural communities are the ones that are exposed to those naturally occurring contaminants because they are, whereas the city, they have water coming from surface water that are much more protected with some kind of protection and treatment of the water, whereas rural community, which are mostly more poor communities, will be much more exposed to those naturally occurring contaminants in the water. So the take-home messages I would like just to highlight here is that we are talking about highly toxic and carcinogenic naturally occurring geogenic contaminants, and they are highly prevalent in global groundwater resources, in spite of the fact that we have not heard about it so much. And the problem is that the chronic exposure to these geogenic contaminants induces multiple health effects. It's cancer, heart diseases, kidneys diseases. And in many cases, it's really hard to build the connection, the link between exposure in drinking water and the actually health outcome. And usually there is a lag of a decade between the impact and the causality of this exposure. And we are talking about a large worldwide population and mostly in rural and poor communities in the US and elsewhere that are exposed to those contaminants. They are not aware, there's not awareness of this problem, and they're not aware of what they can do to protect themselves because there are treatment technology to address those problems. And the real kind of a problem that most folks there are on their own. There's no, in the United States, private wells are not monitored by any of the state or the federal authority. So millions, and estimate about 40 million people in the US alone are totally neglected, and they are on their own with exposure to those contaminants. And with this happy note, I will end up here.
That was so depressing, Avner, but really, really important information. And it's just so pervasive internationally, clearly, water contamination. And a lot of questions pop to mind. You know, you mentioned technology. I'm assuming, you know, education comes to mind, of communities, international and national policy. You know, so many questions about what's happening there. Maybe we can come back to you and you can tell us about like next steps. Here's your research, you know, where does it go from here? We are going to move on to Bill Pan, and Bill is the Elizabeth Brooks Reed and Whitelaw Reed, Associate Professor of Population Studies at the Duke Nicholas School of the Environment. He's also a core faculty member in the Duke Global Health Institute. Bill is also an adjunct assistant professor in the Department of International Health at Johns Hopkins Bloomberg School of Public Health. His research interests focus on population, health, and environmental interactions in developing countries. He has a particular interest in translational research directed towards sustainable development activities and global environmental health. And Bill's going to talk a little bit about indigenous tribes in the Peruvian Amazon and the impacts of gold mining and road construction and deforestation in that area. So take it away, Bill.
Thanks, Mary, and thanks, Abner and Melissa and Subrendu for being on this panel. It's actually really nice to have all of you here. And it's actually a nice thing to go third, just because the things that Abner and Melissa both talked about are very prevalent and important and relevant to things that are happening in the Amazon to indigenous communities, both from a kind of a problem with just environmental justice issues and political rights and law, to the fact that when environmental changes occur, the group that bears the biggest brunt are the indigenous of the Amazon. I'm going to focus on Peru because that's where most of my research has been over the last 10 years, particularly since I've been at Duke. The interesting thing about Peru, the map that I'm showing you on this slide is actually the distribution of the indigenous groups that live across Peru. If you're not familiar with Peru, I can tell you that Peru is divided up between 3 ecological regions along the coast. They have a very dry, desert-like area. Going through the middle of the country is, and I mean middle going north to south, or maybe northwest to southeast. That's the Andes, and then on the eastern side of Peru is the Amazon lowlands. Peru does have the 4th largest rainforest canopy in the world. They are losing forest cover primarily because of the expansion of large-scale agriculture and mining. But I will tell you that logging is a major cause of deforestation as well, probably a 3rd or 4th reason. But the most important thing about logging is the fact that 75% of all of the timber exports that leave Peru are from illegally logged areas. And almost all of that export comes to the United States. And that's what we use for furniture, wood, decks, housing. So when you think about how some of these environmental issues are tied locally in Peru, we also have to think about what's driving some of those demands for different natural resources. So we've been studying the indigenous in a region called Madre de Dios, but in order to really understand some of the structural issues that the indigenous have to deal with in Peru, I wanted to give you a little bit of background on that. And most of this comes from the 2017 census data. So there's about 2.7 million indigenous living in Peru. Most of them live in rural areas. There's 55 recognized indigenous groups. 51 of them are located in the Amazon and 4 in the Andes. But I will tell you that the majority of the indigenous population actually does live in the Andes because that's the largest groups. So the census recognized up to 9,000 indigenous communities, and only about 3,500 or 39% are in the Amazon. When I say things like, structural inequalities and difficulty obtaining resources that the government provides, a lot of that is borne out in some of these statistics that I'm showing you. So the first one is just the percentage of the indigenous that don't have a national ID. So if they want to obtain health insurance or if they want to get title to land, they need a national ID. About 3% of indigenous do not have that, compared to just 0.2% of the white or mestizo population. The educational levels of indigenous are extremely low. 16% are illiterate compared to 4% of the white and mestizo population. For mortality rates and healthcare access, mortality rates among indigenous, especially child mortality, is about double those from of the white or mestizo group. Surprisingly, or maybe not surprisingly, I don't have this on that slide, but about 20% of the Peruvians don't have health insurance. And it's roughly equal between indigenous and non-indigenous. However, when you're talking about access to healthcare, even though indigenous people might have health insurance, access is very poor. Only about 30% of indigenous communities have a health post located in their community or nearby, and which is just an incredibly difficult thing to obtain healthcare if you are born in an indigenous community or of indigenous descent. In terms of actual infrastructure, land ownership, a lot of indigenous do farming, but if you compare how many indigenous actually or do not have title to the land that they work on, about 62% don't, compared to 32% of the white or mestizo population. And then of course, access to improved water source or electricity access, huge disparities between the indigenous and the white and mestizo population. So that's kind of the underlying infrastructure or I would say resources that indigenous have. There's more to it than that, but that's just a starting point, okay? Now let's think about large resource extraction. So the first one are just logging concessions. So there's two big concessions that go on in the Peruvian Amazon. One is for logging and one is for hydrocarbons, and I'm going to talk about both of them. The map on your left, as I showed in the very first slide, is the map of where the indigenous communities are. The map that I'm showing you on the right are the logging concessions, both active, things that are closed, and ones that are permanently are currently under review for being allowed access to the land. If you overlay the two, and it's very hard to see on this map, so the only way to really see it is if I flip back and forth. And if you focus your eye on where the indigenous lands are, and you look at where the logging concessions are, surprisingly, the logging concessions do not really overlap the indigenous lands. They butt right up against the indigenous lands. And the reason why that's really important is because the people who obtain the logging concessions don't necessarily log in the concessioned land. About 68% of the legal logging concessions have major violations of moving into indigenous and protected landscapes to take very lucrative forest trees that they can sell in the market. And it's very hard to enforce any, I guess, protections for the land, especially in different areas of the Amazon where there's no electricity, and there's very limited monitoring that can be done to stop it. But that's just one point, right? So the second one is about hydrocarbons. So hydrocarbons have really exploded since the 1980s. In 2003, about 7% of the Peruvian Amazon was covered by a hydrocarbon concession. By 2009, that jumped to about 41%, and currently about 75% of the total area of the Peruvian Amazon is under a hydrocarbon concession. Since 1980, about 104,000 kilometers of 2D seismic lines have been cut, and those are lines that they basically cut tracks out of the forest, and they set different kind of explosives to look for geologic features that might indicate gas or oil underneath the surface. And 104,000 kilometers is equivalent to traveling from Duke to London to Moscow to Shanghai to Los Angeles and back to Duke, and doing that 3.5 times. So you can imagine the amount of land that they've cleared for just the seismic lines is pretty incredible. And where are the hydrocarbons or hydrocarbon concessions? So not surprisingly, if 75% of the Amazon is covered, Most of the indigenous lands are actually covered by a hydrocarbon concession. About half of the titled indigenous lands, about 42% of the indigenous territorial reserves, and 61% of the indigenous proposed territorial reserves are currently covered by a hydrocarbon concession. Now, we've been studying in Madre de Dios, Peru, as I said, for quite a long time, this relationship initially between road construction and how roads would change the environment, and then how the environment would then impact things like vector-borne disease, malnutrition, chronic diseases, all sorts of different health outcomes. The region that we chose was chosen primarily because this interoceanic highway, which is the black line, if you can see my pointer, that, I don't know if you can see my pointer or not, but the black line that comes down kind of on the eastern side of the region and goes back down to the south. That highway was built between 2005 and 2011. In the 1980s, there was gold that was discovered and a gold rush that emerged. But during the 80s and 90s, deforestation rates were actually quite low, probably in the range of 50 to maybe 1,500 hectares per year cleared, which is nothing, right? It's I shouldn't say nothing, it's very little. All in this region that's covered in the orange where it says the Amaquari Communal Reserve. That was mostly where the mining was going on. Happens to be also where a lot of the indigenous communities are located. Since the highway was constructed in 2005, by 2010, deforestation rates reached 10,000 to 12,000 hectares per year. So it was a 1,000% increase in the matter of about 5 years. Just an incredible rate of clearance. Now, where does this occur? I'm going to show you a video. I'm actually just going to talk over it. This is a video that shows some of the things that are occurring in Madre de Dios, and it's all in Spanish, but it has an English translation on the bottom. That if you'd like to read that, or if you'd like to listen to me, it's fine. It doesn't matter. Either one is fine. But the issues going on in Madre de Dios are problems that deal with both the interaction of road development and gold mining. The gold mining is by far the most devastating environmental effect that you can see. So on the graph, or I should say on the video that they're showing you, that's an example of one particular gold mine that causes permanent deforestation of the landscape. The problem, though, with gold mining is not just the deforestation, is the fact that it's also the leading cause of mercury pollution in the world. Now, if you know anything about mercury, you might know that mercury is a neurotoxin. If you inhale it, you can eat it when it bioaccumulates in fish or food. And what we have shown with our data, as well as with people who have collected other data on humans in Madre de Dios, we estimate that 41% of the regional population has a mercury level that exceeds safe thresholds as defined by WHO. Now, the WHO threshold is different than US EPA. It's slightly higher. So if we use the US EPA cutoffs, it's closer to 60%. The problem is that when we look at indigenous communities, 77% of the indigenous have a mercury level that exceeds WHO thresholds. And if we use the EPA thresholds, it gets upwards of 85%. Now, if this was happening in the United States, this would be a major emergency, and there would be resources put toward this immediately because it is an emergency in terms of the contamination. There are communities that are trying to fight this. There's a federation of indigenous states called FENIMAD. There are individual communities called like Tres Islas that are fighting a legal battle against Peru to stop some mining or stop the use of mercury, or trying to limit the amount of invasion of mining and miners into their lands. But all of the data that we have seen, all the data that our colleagues at Wake Forest and Stanford have shown, is that mercury is disproportionately impacting indigenous, We're seeing larger neurological effects from exposure. We're seeing larger effects on anemia. We're seeing larger effects on hypertension and kidney disease. And so these are things that need to be addressed immediately. It needs to be addressed both from a contamination point of view, but there has to be structural changes that occur in Peru in order to really address the fact that the indigenous are bearing the brunt of these kind of environmental changes. And in going back to my first point about the timber exports, you are probably not surprised to know that the gold that is extracted from Peru, most of it also comes to developed countries like the United States and Europe. And so we as a developed country have a lot of power if we have the political will to actually change the things going on. So that's just something I'll end on, and hope if you have any questions, I'm happy to answer them.
Thank you, Bill. I have about 15 questions, but we will move on for the moment to our next panelist. And I want to reiterate Bill's suggestion that everybody ask questions. If you have any in the Q&A section, or you can hold on to them till we're completely finished with all the panelists. Our final panelist is Suprendu Patanayak. And Suprendu is an Oak Professor of Environmental and Energy Policy at Duke. He has appointments in the Sanford School of Public Policy, the Nicholas School of the Environment, the Department of Economics at Duke, and the Duke Global Health Institute. Suprendu studies the causes and consequences of human behaviors related to the natural environment to help design and evaluate policy interventions in low-income tropical countries. And Suprendu, go for it.
Thank you, everyone. I hope you can hear me clearly. I'm looking at Bill. Voice is clear? Okay, good. Thanks. And like Bill, let me echo, it's great to follow up on Melissa and Avner and Bill and sort of build on what they're saying. I'm going to try to summarize about 10 years of work in 3 slides in 5 minutes. So a lot of it will just fly by. Hopefully there'll be some time for discussion. I'm going to do it by pushing one concept and 2 examples. And others at Duke, outside of the 3 people you've just heard, folks like Randy Kramer and Laurie Benier, Mark Julian, several others have been working on this. Okay, so I know Randy is in the audience there somewhere in the participant list. So the first is this, let me see how to proceed with the slides, is this idea of planetary health. So I had the good fortune of hanging out in Lake Como for a while, but really working on the Lancet Commission for about a couple of years on this concept of safeguarding human health, very much in the spirit of the way Mary set this up and Melissa talked about the connection between the fact that in many ways life has improved. Poverty rates are down, there are more people, life expectancy is high, you know, we're using energy, we're using water, but that has come at a high cost, a very, very high cost. Ocean acidification, water shortage that Avner talked about, tropical forest loss that Bill talked about, temperature change, biodiversity loss, butterflies are disappearing. And so we may have ecologically overshot. And at the same time, as Melissa was pointing out, there has been growing inequality of income and wealth, of risk exposure, of race and gender inequality, and of course of inequality of political power. There's a small election going on in the background. Most of you are probably checking the Georgia recounts and Pennsylvania recounts, but this is a reflection of where the world is right now, okay? And so perhaps this idea of a donut of ecologically safe but socially just is a compass. And this very much ties to the idea of planetary health, okay? So that was my first point. But there is an Achilles heel of this, and that is simply that conceptually we can get the idea of planetary health, that we shouldn't be destroying the environment, we should be making life socially just the world more socially fair, okay? But how do we get about that? And I have argued in a series of papers, including with Randy here, that implementation seems to be the Achilles heel because it's to go from concept, the very many problems that Avner identified, to bringing policies on the ground is challenging. And those have costs and benefits and all kinds of people in defense of them and those who are opposed to them. And that implementation shouldn't be thought as something that politicians have to work out in Washington or in London. That itself also is a science, that there is some work that can be done around that, okay? So I'll give you one example. And this is some work in Indonesia. Some of you know that Indonesia has some of the most pristine and valuable forests in the world. They burn every now and then, sometimes because of climate reasons, but oftentimes because oil palm is being expanded. And oil palm is not a terrible thing in many ways, because almost everything in your life, the iPhone that you have, the casing for that is probably made of plastic, which has used oil palm. So it's valuable, but it comes at a very extremely high cost, because when you use fire to set up oil palm plantations, you get haze. Haze is associated with environmental exposures. And we do a bunch of careful work, better data, better methods, exploiting spatial variation, exploiting temporal variation, all kinds of robustness checks. And we show that in places that saw that spike in haze, that spike in smoke, women who were pregnant, 17 years later, their kids were shorter, okay? So we had paid in human capital costs. But I didn't want to stop at that. In this paper, with this is work with a DGHI scholar, Jisheng Tansu, who is a professor at National University of Singapore. We sort of, look at different policies to not use fire to clear for oil palm. So we look at mechanical ways of land clearing. We look at stronger enforcement and bans and early detection and suppression. And essentially, after all of that, with a lot of simulations and analysis, show that clearing for oil palm using mechanical methods generates higher social net benefits compared to clearing using fires, okay? So there is another way to get that plastic on your iPhone, and that's not going to cause these health costs, okay? But of course, oil palm producers talk about disparities, who is paying, given the title of the panel, have no incentive, none at all, to use a more expensive way to clear the land. So should we be paying them? Of course, that sounds terrible, pay the polluter. In which case, just double up on the fire bans, on the fire suppression and moratoriums on oil palm, okay? So you have to think through the implications of identifying the problem, which is the smoke coming from oil palm sucks. Now, what do we do with that problem? Okay, what needs to be figured out? And this is the cost benefit is just one way to look at it. Political analysis, et cetera, needs to happen as well. Another quick example. Okay, moving from institutions and firms to households. So let's look at this case of cook stoves. Improved cook stoves in theory involve less biomass fuels, okay? Biomass fuels is just a piece of log, it's dung, it's leaves. This is terrible for all kinds of reasons. The climate folks will say that it has something to do with the glacier melting. Okay, it's a short-lived climate forcer. The environmental pollution people will say it has something to do with regional environmental quality and forest degradation. And then the health crowd, like DGHI, will say it has a lot to do with the health of women, of children. And the social scientists will say there's drudgery involved. Got it. There's also a humanitarian aspect to this, okay? One out of 6 billion people, or now what, 7 billion people, are still having to burn a piece of wood to make their first meal in the day, okay? That doesn't seem right, given that most of us switched something on and pressed a button and got our cup of coffee this morning, okay? And there are these many, many, many thousands, billions of people who still don't have access to that. So what we did was, this is a 5-year study. for the first couple of years, we just did a lot of thinking, simulations, and some piloting, okay? Before we ran a trial where we threw all kinds of stuff at people, like, why do you not use a clean cook stove? Brainwash them, bribe them, beat them on the head, all kinds of things to motivate behavior change. And what we find is it is actually possible to get a phenomenal change in people's behavior, but it takes a lot of thought to get there. And the market for that also has to sort of grow and develop. Okay, so my last slide is, especially this is a warning for the social scientists who are working on in this domain. And people like Bill are sort of dabbling at the edges of that. Melissa is certainly working in this space. Is we shouldn't get into a rat race with epidemiologists about how their methods suck, and we should do, we've got some clever identification strategy using this instrumental variable. That's just pointless, right? We should focus on what we are good at: institutions, behavior, incentives, and try to focus on that, right? And think about what policies have to be brought to bear to deal with this challenge of environmental degradation, because the exposure is coming from something outside of the health sphere. It is happening with land clearing that, as Bill mentioned, like, that landscape that he's looking at. All kinds of actors are out there, and they're doing all kinds of shit for all kinds of reasons. But there are reasons, and we have to figure what that is so that the exposure changes, okay? And there is a science behind that. So you have to cross disciplines in the spirit of what DGHI is about. And if you can do that, take the results that Avner has and others, you can measure and map the entire evidence change. And of course, you have to mix your designs. You can't just go with all these highly techy, quantitative, randomized controlled trials. Qualitative work is important. Content analysis is important. And above everything, you don't have to be Nate Silver to understand that there is uncertainty in every one of our analyses. And so simulations, Monte Carlo or otherwise, are sort of important in this, okay? And I'll stop.
Thanks, Suprendu. That was very interesting. I feel like we covered so much ground in the last 50 minutes. So just one quick note, I shared a couple links from Suprendu's talk. He had shared some publications based on his talk, so they're in the chat. I got a lot out of that planetary health piece, which I just thought I was going to skim, and then I ended up reading it at 1:45 last night. So I would highly recommend that while looking at election data. Anyway, I want to, since we only have 10 minutes, let's put it out there to everybody in the audience. I don't see any questions in the Q&A or the chat. Does anybody want to drop a question in there? Please feel free. In the meantime, I will ask a question. Something that comes to mind just listening to everyone is just there's this vast number of environmental issues impacting so many communities, and in turn, endangering health. How do we know when we need to be addressing something as a global community versus a national community versus a local community? And I'm going to start with Melissa, because I know you do specific work in Durham, and some of our audience is from Durham. So maybe each of you could kind of talk about that.
So just to clarify, your question was what's happening in Durham, or how do we know?
When you have a major environmental issue going on that's disproportionately affecting a specific community, a low-income community that already has its own health issues, how do we address it? Should we be, we're all from the Global Health Institute. Should we be addressing it, looking at it as a global problem, as a national issue? Where does the policy change need to take place?
Right. Great question. And there's a long history in terms of environmental protection that policy takes a while to reflect morality, right? So people can have feelings and opinions about things being wrong, but it takes a while for policy to really reflect people's value. And this is true not just of environmental protection, but the long history of enslaving African Americans. It was always immoral to do so, and then policy eventually caught up. I think that in the context of local, global, national policies regarding air pollution, climate change, and the built environment, that we shouldn't wait always for policy to enforce laws, but do so at the community level, right? Because systemic racism is pervasive, and what we can do together at the individual and community level is really important. And an example of this is that there's an association between the long history of redlining and temperature. So when there's lack of capital and financing, for example, by cities to build trees and create greener infrastructure, that the urban heat island effect actually is exacerbated in climate change. And there is some really great and impressive push right now by Durham to plant up to 45% more trees in some neighborhoods that are primarily African American communities. And that's great, right? But again, with the time-sensitive issue, if you will, of climate change, air pollution, there's things that within our community, I think that we shouldn't have to wait for policymakers to, go through some red tape and say, this is what we're going to do, but do things that we can and help make our neighborhoods more walkable and bikeable, and have more access to green space and blue space. It's really good for mental health and cardiovascular disease outcomes.
Thank you, Melissa. There's actually a question in the chat for Avner that addresses kind of community. Avner, it's from Randy Kramer. Thanks, Randy. You made a convincing case that millions of people around the world are adversely affected by the little known problem of naturally occurring toxins in drinking water. Is there any country in the world that is adequately addressing this issue? And I would add to that, is there any community in the world specifically?
I'm afraid not. And I think I wouldn't see an example of a country that is addressing it. Most of those communities are similar to what we see here, are left alone to their own fate to deal with it. And in this, I would like to go back to the topic that just now Melissa kind of talked, is how do we address those issues? And of course, what Randy is raising, do we continue what we have done for the last decades, meaning bringing the science and bringing, the top, writing nice, amazing papers like Subrendo's? Does it work? And the question, always ask myself, always saying we need to bring the science, and science will prevail and the logic of people will take place. And what we see in this country, at least, it doesn't work. We need to be frank and honest about ourselves, that this attitude is not really working, and perhaps we need a different strategy to highlight to the people that they are actually under threat. And the idea that if we talk to the logic and we talk to the policymakers and convince them, the way we have been doing, which we failed, think about the outcome of this election, regardless of the final result. But the fact that I would say, almost 50% of US citizens do not care about climate change. Let's put it on the table. That is a problem that we may need to rethink how we address the people. And I think one of the methods to address is really to go back into, very vulgar and very unprofessional way of saying you guys are going to, it's going to affect you, and kind of having a really drastic and aggressive way of delivering the message.
Thanks, Abner. This is an emotional conversation. Bill, you had mentioned Fedimod and Isthmus, I think, and I don't know what those are, but I think it was in relation to mercury. Are these localized? I think you said they're groups within Peru that are addressing some of this.
But before I comment on that, I think Subrendu wanted to mention something about Avner's last comment. I also wanted to mention something that about communication with the public. You know, I think this lies in the area of science diplomacy and how we communicate properly and how we engage, how we as scientists engage in policy implementation. I actually really liked Subrendu's last point on a slide that says, bring science to implementation, whereas most people think about implementation of science, right? So you bring the science to the policymakers versus not the reverse. I don't know, Subrendu, if that was what you were going to mention, but.
Yeah, so I just want to make a plug for this whole concept of type 3 errors. So in our DGHI and in all the programs in academia, we are pushing for minimizing type 1 and type 2 errors, you know, false, nulls, and et cetera, right? But we are precisely answering pointless questions a lot of the times. I would much rather, in a way, get a rough answer to the right question, right? Which is done quickly and get that. And part of that involves building on Bill's point, you know, again, what do we push? Evidence-based practice. Don't do anything in the policy space on the ground till you have the 10 years of evidence. I'm saying flip it around, practice-based evidence, okay? Build the bloody evidence base around what people are already trying to do on the ground, which involves going to communities. What are they actually doing? Can you do research around that? It may not be perfect. It may not be publishable at the top journals, but it's some data that they need to like make some sense out of going right or left, yeah? So we got to get a little dark and dirty. Maybe it won't, you know, go to the highest places, but places like DGHI are created to give us that maneuvering space so that we are not in the world of what the medical school wants and what the chemistry department likes, and you know, screw that, yeah? We have important problems to solve right now.
Can I add to that point if there's still some time?
Yeah, absolutely, Melissa.
So I'm thinking right now as you're speaking that, you know, in the case of climate change, right? So there's that awesome youth activist, Greta Thunberg, who is a descendant of Svante Arrhenius, who it was 1800s discovered that CO2 was causing warming in the world, right? And yet we've had substantial evidence of this warming effect for hundreds of years, and it didn't make behavioral changes in people with the scientific evidence, so much as a recent study that showed that Pope John Francis's ethical plea to people in the Catholic community that climate change was happening showed some behavioral changes in Americans. So I just wanted to add to the point that it's so important to have evidence, but yet belief is so powerful in human behaviors that, you know, coming up with solutions for having voices that aren't just in science to communicate to people who, by people rather, that will be believable. Not that we scientists shouldn't be believable, but recognizing that there's this gap in what we communicate and the evidence that we produce to changing behaviors that are really important.
Yeah, that's very powerful. It's like we need a person who's a behavioral psychologist, environmentalist. I don't know.
No, it's not one person. You got to work in teams. It's just,
yeah.
There's no way you can be an expert at all this stuff.
Nope.
Yeah.
This is no way.
Thank you, everyone. This has just been such a delight to like not think about the election for an hour.
Well, I have the Georgia screen minimized it. I'm watching it tick. So
I'm tempted to ask where we are, but let's not go there. Let's just thank you from the
12,000
bottom of
books.
our hearts and wish you all a very good rest of the day and rest of the week. Thanks, everybody.
Thank you.
Thank
Okay.
you, Mary.
Thank you.
Everyone.
Great job, everyone.
To see you. Bye.
Bye.